So obsessive compulsive disorder is an anxiety disorder in which individuals will experience intrusive thoughts, unwanted thoughts, and that's the obsession. And they can be of different contents. So you'll hear sometimes people are very afraid of contamination, fear of germs, needing things to be in a certain order. So that obsession in that situation would be a need for symmetry, for example. And as a product of these obsessions, individuals will develop behaviors or rituals that they perform in order to reduce that anxiety associated with those unwanted thoughts that they're having. And so the compulsion is the behavior that they're doing to reduce the obsessions. So a compulsion can be things like washing hands excessively, having specific rituals for showers, counting, organizing things, having things in certain alignment. So that's what we're talking about when we're talking about what is obsessive compulsive disorder. You have to have both of those things, both the obsessions and the compulsions. And this has to interfere with an individual's functioning. So this has to interfere with someone's ability to work, or their performance at school, or how they're functioning in their social life. There's many treatments for obsessive compulsive disorder. The main ones are medications in the form of selective serotonin reuptake inhibitors, so SSRIs. But then there's also psychotherapy, so talk therapy, that can be used to treat obsessive compulsive disorder. Cognitive behavior-based therapies are the ones that are used, and these are to help individuals change how they think about things, so cognitive distortions are modified, so they become maybe less afraid of germs, but also trying to extinguish some of those behaviors that they're doing as a result of those thoughts that they're having. So that's kind of the main treatments that are offered for obsessive compulsive disorder. Obsessive compulsive disorder affects about 2% of the entire population, and we know of that group, about 30 to 40% of them will still have symptoms despite treatment. And so even with what we have in terms of treatment, medicine, psychotherapy, a lot of folks are still walking around there with symptoms still. And it's important to know the indication for deep brain stimulation for these patients is in people that are so sick that they're completely incapacitated in their lives. So it wouldn't be someone that has got pretty good symptom control with their medicines that we would want to pursue this for. These are people that are not getting any symptom relief. You would refer to these patients as having malignant obsessive compulsive disorder because it's so debilitating. So that's the kind of patients that we are dealing with in our program.